Welcome back to Living 808. March is National Colorectal Cancer Awareness Month. Now, here to talk about lifestyle changes that can help improve colon health and delay or prevent problems, Dr. Mel Ona. Hello, thank you so much for joining us.
Nice to see you. Thank you, Trina.
Nice to see you, too. Okay, you've brought a lot of food here, but before we talk about the food, tell us about colon cancer. It is a common cancer.
Yes, in fact, it's a preventable cancer, and in fact, Aloha Stadium, 50,000 people can fit in that stadium. That's how many people, at least 50,000 people, die of colon cancer every year.
Every
so
year.
It is preventable, yes.
Okay, but it is preventable.
Yes.
So you've brought a lot of healthy food here.
Yes,
I'm guessing diet is one way to prevent colon cancer?
It is. You know, as Hippocrates said, all disease begins in the gut, and the GI tract is one long tube, and so your gut is really a gateway to good health. So what passes through can either nourish your health and energy, or create inflammation, contribute to obesity, and cause troublesome symptoms.
Okay, great. Tell us what you brought here.
Sure. So we have here some nutritious and delicious food. We built a plate where you can see divided in half you have some protein, carbs, and fat. This half is non-starchy carbohydrates, vegetables, and the other half is protein, a lean protein source, and even a healthy fat like this avocado. And there's a starch here, which is a sweet potato. Now, we also have over here, for those on the go, you can bring this to work, you also have a non-starchy carbohydrate here and a starchy carbohydrate like the brown rice. And you can add protein sources like the chicken breast, turkey breast, or even eggs. Or those who don't eat meat can put beans or legumes there as well.
Okay, all of this looks really delicious, you know, because sometimes people think, oh, healthy, there's going to be no flavor. But what you brought here, it's really good. And also, a lot of people may think, oh, carbs are bad. But not true. I mean, there are healthy carbs.
In fact, yes, indeed, these non-starchy carbohydrates, that comprises most of the plate, very healthy. So I would not limit those at all.
Okay.
And going farther here, you can see we have some fruit, which are rich in antioxidants, very good for your health, and also some fiber. And also the healthy fats, you can see a variety of mixed nuts. And this over here is olive oil, which is a very healthy fat that you can add to your vegetables as well.
So what are some lifestyle tips to help improve colon health and possibly even prevent cancer?
Sure. So besides eating a healthful diet by avoiding processed foods and consuming fiber, I think that regular exercise, particularly weight-bearing or resistance-type training, can help people lose excess body fat. Why is that important for colon health? Well, if you're obese, obesity, as we know, has been associated with diseases like heart disease and diabetes, but also GI diseases like gastroesophageal reflux disease, but also colon polyps. Now, colon polyps are abnormal growths of tissue. They can be precancerous. So that's one way that we can prevent that.
You know, we are talking about ways to prevent colon cancer today, but what are the signs or symptoms of colon cancer?
Sometimes there are no symptoms, but you can have blood in the stool, which can be an alarming feature, and that would prompt you to at least seek medical attention and get worked up for that.
Okay.
Yes.
Tell us about your practice.
Sure. So we are Hawaii gastroenterology specialists and Covenant surgical partners. We have 5 board-certified gastroenterologists and a physician assistant. Our main office is in Aiea, and we perform endoscopic procedures at these outpatient centers owned by Covenant surgical partners, such as the Pacific Endoscopy Center in Pearl City. So we treat a lot of gastrointestinal maladies, ranging from reflux disease to pancreas, liver, biliary problems, and of course we do provide screening colonoscopy, which is the gold standard for preventing colon cancer.
Okay, and how early should someone get a colonoscopy?
Sure, if you have symptoms such as rectal bleeding or even some type of pain, you can get a colonoscopy. But by our guidelines, if you're at average risk for screening, meaning you have no inflammatory bowel disease or no family history, like primarily mom, dad, brother, sister don't have colon cancer, and it's typically age 50.
Okay.
Now, important to know also, our guidelines state that if you're African American, to get screened earlier at 45 years old.
Okay. Doctor, thank you so much. Very important topic, and you know, I feel like whenever we talk about preventing cancer in general, it doesn't matter what type of cancer, diet and exercise are both so important, right? And that's something we have control over.
Very important.
Yeah,
Yes.
thank you. Thank you so much. Coming up, we head to the Servco Home and Appliance Showroom. Now, the next generation of refrigerators